Anyone who is a victim, witnessed, or experienced a life-threatening situation can experience symptoms of post-traumatic stress disorder. Among people who are victims of severe trauma, 60 to 80% develop post-traumatic stress disorder.
Depending on the severity of the medical illness or situation of a patient, they have a 20 to 70% chance of developing PTSD.
Children involved in situations of domestic violence are described as being in a type of war zone.
Survivors who have witnessed horrible tragedies, such as the Aurora Theater shooting and the Columbine massacre, will have trauma long after their physical wounds have healed. 3/4 of students who witness a school shooting may develop post-traumatic stress disorder.
Patients who struggle with PTSD typically suffer with hypervigilance, substance abuse, anxiety, and flashbacks.
Survivors of child abuse often face attachment, communication, sexual intimacy, and social adjustment issues.
One way that a law enforcement officer can develop PTSD is viewing the murder of a fellow officer or viewing the body at the scene. For example, last month down in Richmond, Virginia, there was a state trooper, Master State Trooper Walker. He was going to assist a car that was pulled over because it looked like the car was in distress. A person got out of the car with a shotgun and started blasting away at the trooper. The trooper returned fire, but was hit multiple times. Another trooper responded to the call, shot at the suspect as he was fleeing, missed hitting the suspect, and as a result he saw his friend get shot and killed, and now this officer will probably suffer from post-traumatic stress disorder for quite a while after seeing his fellow officer murdered. Another scenario where law enforcement officers can develop PTSD is where they view child victims, or where they go into a scenario where the victim has been dead, especially if the officer has children at home.
Patients who struggle with medically based PTSD have two different types of treatment they can do. The first one is evidence-based therapy, which is based upon the severity of their illness. Second, they can do cognitive-based therapy, which helps them deal with flashbacks, anxiety, and hypervigilance. Patients who want to use medication for their illness can also take opiate-based medication to help them lower the severity of their symptoms and/or overcome them.
Victims of child abuse and other related traumas often find help in individual therapy and group treatment.